Welcome, everybody. So happy to see you here for our coping skills tool belt. We're going to be offering these meetings 1 to 2 times a week, depending on guest speakers, and I'm going to facilitate and also invite an expert mental health specialist on all sorts of different topics. Next week, we're going to be focusing on mindful breathing exercises to reduce anxiety and your trauma response, and I'm going to be presenting that. And then Tessa Vining, raise your hand, Tessa, who's an associate at MindSoother and one of my trusted friends and colleagues, will be offering a workshop next Friday on EMDR techniques. And I just wanted to reiterate that this is not a clinical training for you to use with your clients. This is a training for you to use with you as healthcare workers on how to reduce your anxiety, stay grounded, reduce your trauma response during this very challenging and difficult time. So keep in mind that you might learn a few things that you could use with clients. And at the same time, this is not a clinical training. There's no certification. So everyone is familiar with the chat feature. If you hover over the bottom bar, there's a chat. If you have questions at any point, hi, Noreen.
Awesome.
How are you? If you have questions at any point, just pop them in the chat, and then Kara will be taking breaks and we'll answer your questions as we go along. And this workshop will go until 12 o'clock. Okay, so let me introduce myself. I am Dana Markson. I am owner and director of MindSoother Therapy Center, which is a group private practice in Livingston. Even though we're not in Livingston right now, we're all over sort of Essex and Morris County. Our practice is 100% online, offering 9 weekly groups, individual and family therapy. And we specialize in DBT skills, and I have a subspecialty in eating disorders. I'm also owner of Rockstar Practice, which is a coaching practice for therapists to optimize and actualize your ideal private practice. And you can join our Facebook group, which I'll put in the chat at the end. And so that's a little bit about me. I've been a therapist for 26 years, very happy to be facilitating this as a way to give back to the community and help our fellow therapists and healthcare workers during this difficult time. So welcome, everyone. And I want to introduce our guest expert for today, who I've known via the community for many years. Kara's a licensed clinical social worker and has a private practice called Maximize Wellness, located in Chatham. And I'm just going to read a little bit about Kara. She's dedicated to helping people who are feeling overwhelmed successfully navigate through life's challenges. Her therapeutic approach is supportive, collaborative, mindfulness-based, and trauma-informed to help people who are experiencing symptoms of stress, anxiety, and depression. And when I thought of having our first guest speaker, I know that Kara uses Brainspotting in her work with clients, and I thought she would be a wonderful addition to this group and could be very helpful in learning some new techniques today. So welcome, Kara Maximo.
Thank you. Thank you so much for having me. I want to get started by just telling you a little bit. I think you did a great job kind of explaining my background. I am an LCSW. I got my master's in 1996, although somewhere in there I took a 13-year hiatus from 2000 to 2013 and came back into the field in 2013, 2014 in private practice. So that's a little bit about me, and anybody who wants to reach out afterwards, I'm happy to chat if anybody has any questions. I'm going to share my screen. Let's see if this works. Okay, did that work? Do people see my screen and can still see? Okay, hopefully it worked. Okay, so I want to talk a little bit about Brainspotting. Where you look affects how you feel. And let me move into kind of the key points. We want to talk about the history behind Brainspotting. What is a brain spot? We're going to do a processing exercise together. We're only going to do a few minutes, but we're going to do a processing exercise together on Brainspotting, and then a processing on what's called Virgins. And then I have a slide which has a bunch of resources. I wanted to just tell a little bit of a story of how many people here know what Brainspotting is. I don't know, any hands? Few people? Okay. Yes, no? Okay. So giving a little background, I started practicing again in 2013. I was so fascinated with EMDR, especially after reading the book that I think everyone, The Body Keeps Score. I said, I want to learn EMDR. This is really important to me. I think it'd be great part of my practice. And I started doing some training. I did just a few full day trainings and looked into how to go through the full process. And in the meantime, I'm on a Facebook group with therapists from all around the world. And somebody had posted, hey, I'm looking to do Brainspotting or EMDR. Which do you think is a better option? And I thought, Brainspotting? What is Brainspotting? I had never heard of it before. So that piqued my interest. And I took a course through Sounds True and bought David Grand's book on Brainspotting. And immediately I knew that this was the fit for me. So that's when I started training in January of 2019, so last year. And I was certified in December. So I've been using it in my practice with my client population for about a year now, on and off, more so obviously more recently. And we're going to talk about that today. Anybody have any questions before we kind of get started?
If you have a question, you can raise your hand. Let me see if I can exit full screen, or you could put it in the chat.
Okay.
Anybody have a question? No.
Okay.
I think we're good.
Obviously, with any type of therapy, right, the goal is to move our clients from dysregulation to regulation. And we're going to practice a little bit of that today. Brainspotting engages the regions of the brain that are specifically neurobiological. So it bypasses the regions that are not involved in it. The way I kind of identify it is, I don't know how many people are familiar with the Dan Siegel's, that using the fist as the brain model. I look at it as, if we look at this as our prefrontal cortex, where a lot of our therapeutic models operate, cognitive behavioral therapy and they kind of focus on the prefrontal cortex, right? To be able to downregulate some of the amygdala and the areas of the brain that are more in our limbic system. Brainspotting, the aim with Brainspotting is it engages directly in the limbic system and the fire alarm part of the brain. Because a lot of times when we're in a difficult, stressful, traumatic situation, we disconnect, right? We don't necessarily are thinking logically. So where Brainspotting can access regions that are not usually involved in a lot of talk therapy. So what I want to do is go into a little bit about the discovery. So for those of you, it's helpful to understand the history of how Dr. David Grand came into finding Brainspotting. It wasn't that long ago. It was in 2003. He had been working with a 16-year-old figure skater and was doing 90-minute sessions with her for over a year. She was struggling. He works a lot with sports and sports performance in his practice, and Brainspotting works very well with sports performance. She was trying to do a triple loop. Now, I know nothing about ice skating, but from what I've been told in this story is that it's not a hard thing to do. So a very accomplished figure skater who can't do the triple loop is a bit of a problem. So he was using EMDR. And with EMDR, a lot of you know, you're using either your finger or you're moving across the visual field. When he moved across the visual field, he noticed that one spot that there was this eye wobble and freeze, like some sort of response that he had never seen before. So he instinctively held his finger in that spot and held the gaze and asked her to just stay focused in that spot and see what happens. And over time, for 10 minutes, all kinds of material poured out, material about abandonment, divorce, injuries, a lot of stuff that hadn't really come out in an entire year of treatment. And even some areas that they had thought were resolved in their treatment had come out. And the next day, she actually went to and did the triple loop successfully. And so he said, there's something to this. The other thing to note is a lot of David Grand's clients were also therapists. So he basically got so excited by this that he started trying it with other clients or patients that he was working with who were therapists and said, go try this with your clients. So it came like a little bit of, see what happens, try it. I don't know what's different, but let's try it. And that's how it really started to look at what Brainspotting is. Any thoughts or questions? Yeah, is anything coming up in the chat at all?
Just, can you share the presentation, the PowerPoint after? And I said, with your permission, I will do so.
Oh yeah, I have it in a PDF form too, which might be easy. I have a PDF, and you know what? If anybody wants to email me afterwards, I can send the PDF to anyone who emails me afterwards. And my email, I think you're going to put it in the end.
I did already, yeah.
Okay, perfect.
I just want to stop you for 1 second, Kara. Can you guys all see the slide and Kara's face? Because she's going to be using her hands. So if you can't, if you go up to the top where it says view options and you scroll down and click on side by side and make sure Kara's face is at the top, you'll be able to see the slide and her face at the same time. Can everyone just take a minute to do that? And give me, if you click on the reactions button, please give me a thumbs up if you were able to successfully do that, so that I know that everybody can see Kara and the slide. You can give me a live thumbs up or you can press the reaction. Okay, so this way Kara can keep her slides up and you can see her face because she's going to be using her hands.
Okay.
And Kara, you have that as well, right? You can see yourself.
Yeah.
And so,
yeah.
Excellent. No questions so far. I will stop you if I think
okay.
anybody needs a question answered in the moment.
Okay, so kind of looking at what a brain spot is. The idea behind the brain spot is it's activity in the brain that's in response to focus and eye position. So in not just reading the slides, but the human brain is a mechanism that is constantly processing information, and trauma can overwhelm our brain, leaving unprocessed experience kind of frozen in time and space. The way I look at it, I like to simplify things into really manageable verbiage. And I use the idea that if you think of your brain like a filing cabinet, and traumatic and difficult experiences get misfiled, which is why we get triggered easily with those experiences. And a lot of our clients that we work with, for us personally, when we get triggered, it's because that experience is misfiled in an area that is inappropriately filed in our brain. And brain spotting is like looking for that eye position that can actually access the file, open it up, and allow our brain's natural healing capacities to do what it needs to do. So that's kind of my description of how it works. So when you think of our retina was originated as an outgrowth of our central nervous system. It was one of the, when we're still developing in utero, the eye and the retina is one of the first things that develops directly from our brain. So the central nervous system has over 200 million working parts that access directly to limbic system processing, which bypass the prefrontal cortex. So kind of going back to that Dan Siegel hand model, right? The prefrontal cortex, our thinking brain, where we make decisions. And a lot of our talk therapies focus on our prefrontal cortex, right? Naming it to tame it, right? So that we can reduce the amygdala activity, but sometimes that's not enough, right? And our limbic system is activated even if we don't know or want it to be activated, and we don't necessarily have control. And a lot of us who are mindfulness experts, like a lot of people here, you guys mindfulness, you know that kind of mindfulness can actually access and help to go bottom up, I mean top down, to strengthen that top down response, whereas oftentimes we need to directly connect with the limbic system in order to really heal. So this slide that I pulled up, it's hard to read, which is why I put a little description on the side. This is not from any of the brain spotting training or material, but for me, as somebody who needs a little help with some of the science, I like to have a little extra description. And Janina Fisher's certified clinical trauma professional training. I've done phase 1 and 2, and this is one of the handouts from her training, which I thought fits really well in with brain spotting. And it's just a reminder that, you know, the brain scan shows that when we remember a traumatic event, the memory centers in our frontal lobes shut down, and we feel overwhelmed by our feelings and impulses, because the limbic system is where we respond with increased activity in the amygdala, and we remember things more in our bodies and our emotions and our feelings. And that's something to keep in mind, which is a really core concept on why and where brain spotting fits in with a lot of these types of situations and traumatic events, which a lot of us are going through right now, right? We're not only trying to help our clients right now through something really difficult, but everybody's in the same boat, right? So any thoughts or questions? So Because we're doing this in a Zoom setting, it's going to be different than I would do it necessarily in office or even one-on-one. So I wanted to just kind of talk about some of the other factors with brain spotting. So the attempt here, and this is a picture in my slide of David Grand, who's the founder. The attempt is to access the regulatory capacities of I can never say angular isocortex and the allocortex through a dual attunement frame. And what they mean through dual attunement frame, it's the combination of the relational and neurobiological attunement of interpersonal neurobiology. So a lot of Dan Siegel's work, and the attuned presence of the therapist supports healing. And most of us know that a lot of the work we do, no matter what we're doing, whether it's CBT, ACT, whatever we're doing, a big part of how we heal our clients has to do with our connection, attunement, and presence with them. It's a big part of all the research that shows that a fully attuned, compassionate, connected therapist makes a bigger difference than the type of model that you use in therapy. And brain spotting also follows along with that it's the presence of being completely attuned with your client in that space that helps the natural healing in the limbic system.
I have a question, Kara. Can you say a sentence or two about how brain spotting will help us as therapists or healthcare workers stay connected to our clients when we're experiencing some similar feelings, emotions, reactions as them? Like what specifically will the mechanism of brain spotting do to help us?
So if we're doing it with clients or just in our own?
For ourselves.
Yeah, so even being connected to what's happening inside of your body and noticing what's happening with your client, it can help you to be more connected. So if you're noticing things that are happening with your clients even through their eye movement. So there's a thing called gaze spotting, which we're not really talking about here, but gaze spotting is a type of brain spotting where if you notice your client is talking about really charged information, but you notice they're not making eye contact, which, right, how many of us know that sometimes they don't make eye contact and you're thinking, what's going on, but they're looking off in a certain direction. Asking them to stop and say, you know what, I noticed as you were telling me that story that you kept looking right over here. I'm going to ask you to just notice what it feels like as you continue talking and keep your attention focused in that spot and notice what happens. Let's just pause there for a minute and just hold that space. So even that gaze spot is they're connecting to that content in their limbic system as they're talking, and that spot may help them to access and process more efficiently or effectively. And then us as the therapist being attuned and noticing where they're looking and noticing what we're feeling in ourselves and where we're looking can also make a difference.
That's very helpful. Yeah. Thank you.
So just before we practice, and a couple of key points, there's no wrong way. And I think I believe that because I chose to do brain spotting when I was deciding between brain spotting and EMDR, and I know you guys are doing EMDR next time, I think EMDR is amazing. I just didn't have the financial or the time to say, okay, I can't do everything. So this is the choice I made. Mm-hmm. But a lot of the things that led me more towards brain spotting was the idea that there is no wrong way. David Grand is really, really strict about the idea that the client is the head of the comet and the therapist is like the tail. Whatever happens in session, the client leads the way and we just go with it. And maybe that's not the best way to describe it, but we as therapists are really following along our client's lead, and it's encouraged to use CBT and mindfulness-based therapies and DBT and psychodynamic, whatever you use as a clinician, you incorporate with the brain spotting practice. And that's how he likes it to be used. So it's very flexible and adaptable. And for me, being the kind of person that's how I practice, I was more connected to the idea that it wasn't, okay, do this, do this, do this. It was very much of do what works. Mm-hmm. So that's something to keep in mind. Brain spotting uses bilateral music, which is, so for those of you who want to self-practice on your own, if you Google on like Apple Music or iTunes or even any like online streaming music that you have, if you put in either David Grand's name or brain spotting or EMDR, you can pull up so much. I have a playlist from iTunes with like 7 albums. Half of them are EMDR albums that I play in my office. And so the way you want to do it is bilateral music is hitting each ear. So it's stimulating the brain processing by using the bilateral sound. So it's panning from ear to ear. So in a setting like this, it's really hard to use the music because it wouldn't necessarily work unless you had separate earphones. What I would ask is if you are doing it with yourself, you might want to pull up some bilateral music. You can even, the Insight Timer app, the Mindfulness Insight Timer app, if you put in bilateral music or EMDR, there's some bilateral music even in the Insight Timer meditations that you can use. I use those a lot too, personally. Even in my office, I use, I have speakers that I put on either side of the couch so that I could hear the music without headphones if I have, so that it's bilateral. There's 2 models. There's an activation model, which is when the client is pairing up with the place in their body and their experience that's activated by the traumatic thoughts or issues. And then there's the resource model. And the resource model is pairing up with a part of the body where they feel the most calm, safety, or grounded as a resource. And I think that's important to keep in mind, because in all brain spotting trainings and all the times I've talked to other therapists about brain spotting, when we practice, what I like to do is ask people to think of an issue that's on their mind right now, but not to think of an issue that's highly activated. But right now, a lot of us are highly activated. And I don't think it would be very, very appropriate to say, you know, think of something that's not that activating. So what I'm going to do is work with both the resource and activation model at the same time. But I ask that everybody do what's comfortable for them. If you feel like it's too activating, then you might want to switch more to the resource, if that makes sense.
Mm-hmm. Is there any questions about that before we jump into practice? Any questions about which model to use for yourself? You can put a question in the chat if you have a question, and then I can read it out loud. But we are going to practice now ourselves. Kara's going to lead us.
And I'll take my time going through the setup for the practice so you know more what I mean about resource versus activation, because I want to make sure that we're doing what's safe and comfortable for everybody who's listening on the call. So the first thing is notice how you feel about the situation you're in, whether you feel like you want to talk about or think about what you're experiencing in your practice, being home, your family, whatever it might be, the situation that you want to process. If you can kind of just pull that up in your mind and then notice what your SUDS level is. So does everybody know what a SUDS level is?
Why don't you just say real briefly, so everyone knows.
Unit of distress is SUDS, and it's an EMDR unit that's used in a lot of EMDR. So it's subjective unit of distress. So think about on a scale of 0 to 10, if you're noticing how you feel about the situation, where would you give it a number from 0 to 10? So 0 would be, I feel totally fine, no activation whatsoever, I'm all good. And 10 would be kind of the highest level. So on a scale of 0 to 10, where you feel like you are when you're thinking about this situation that you feel like you want to process right now. And I'll give you a few seconds to find that. Here's where I want you to be really mindful of what you need right now. So you're going to do a body scan. So you're going to, as you're thinking about this situation, I want you to notice where it manifests in your body. For some people, it's a tightness in your chest. For some people, it's your shoulders. Wherever it might be, just notice how and where it manifests for you. And where I'm going to ask you to check in with your SUDS is if your SUDS level is above a 7, then I want you to scan your body for the most grounded or relaxed place. So if you're feeling really highly activated right now, you're going to look for the place in your body that's most grounded and calm. Sometimes I hear people say, I can't find any place that's grounded. Everything's activated. So keep in mind, if anyone has trouble finding a calm or relaxed place, think about focusing on a place in your body where it's kind of all cartilage, right? So there's no way you, like the tip of your nose, or focus your attention on your earlobes, or some place that you know that there's no physical sensation of distress or activation. And if you feel comfortable enough to focus on where you're activated, then you can absolutely go there. But just keep in mind which is better for you. Okay, so then I want you to hold up a pen or an object. This is the pointer that I use. Because you can't see much, there's not much of a visual field in my screen. If you hold up a pen or an object at eye level, start with putting it on the left-hand side. It's kind of, mine is outside of your visual field right now, which is why it's better off to have one in your space. If you were in my office with me, I'd be doing this kind of sitting a few feet from you. Move it to the left, and notice the part in your body that you're choosing to focus on. You know, notice the situation that you're thinking about, and just notice what happens and what comes up. You're going to move the object more towards the center of your visual field. And then to the right. Notice for yourself where, if anywhere, you're feeling the strongest. Where does it feel the most connected? Is there, if you're focusing on your activation spot, what spot did you feel the strongest? And if you're focusing on the calmest, where does it connect most to the calmest? So I want you to focus on that area of the space that feels the most connected to where you feel it in your body. And then we're going to I'm going to set a timer to just sit and process and just notice what comes up. You know, once you find that spot, keep the pointer in that spot, and then just allow yourself to notice. You may find that the spot in your body moves, it changes, it may get more intense, less intense, but we're going to try to focus on that spot. We'll give it another minute of processing. That was my phone timer. Anybody notice anything? Any changes? Anything they want to share? If you want to type it in the chat or raise your hand.
You guys that have your video on, I sort of noticed just taking the focus and putting it on one object, I sort of felt my body relax a little bit after a minute or two. And then as I was scanning, I sort of was feeling other tight areas. So my area I was working on feeling grounded because I had get like a yucky feeling in my belly when my SUDS is like a 6 or a 7. And I just noticed that just the idea of focusing on one thing quieted my mind and my body, and it felt really good.
Okay.
Anybody else want to share? Raise your hands like this in the screen. Tessa?
So I noticed I had more of a panicky feeling right here at the top of my stomach when I started my focus. And then after kind of staying in that space, it was able to relax a little bit. And then I was able to think a bit broader about maybe what was driving that feeling.
Yeah. Yeah, Tessa, thank you.
Lovely. Anybody else? Raise your hand if you want to share. I'm just scrolling through. Amy, you have to unmute yourself, please.
Hi, similar to you, Dana, I had just a feeling of being grounded. Like I noticed sort of my tush getting really, really like melded to the chair, just feeling very grounded and feeling like I was definitely breathing more deeply and just felt relaxation. That was the thing I connected with most.
Nice.
Great.
Thank you. Anyone else? Take a quick scroll through. Let me just see, raise your hands. Okay, I think that's it.
Okay.
Thank you everyone for sharing.
Yeah, thank you. So what I wanted to kind of point out too is we only looked at left, center, and right, and what we looked for was what was the most connected, right? So when we talked before about how the nerves in our eyes kind of connect directly into our limbic system, and we're looking to find where we hold on to that trauma or strong reaction. And 2 or 3 minutes is probably not enough to make a noticeable difference, but it's great to hear that there was a little bit of a calming. So with Brainspotting, just as an FYI, if we
wanted to share something, can we pause for 1 second?
Go ahead.
Dana, just unmute yourself. Or I could do it. I did it.
I'm so sorry to interrupt, but I did type something in the group chat and I didn't share it like verbally, but I did feel this overwhelming sense of emotion after I experienced the calm grounding feeling. Mm-hmm. And my eyes actually teared up, like welled up with tears. And it was really kind of powerful, mm-hmm. and I didn't expect it, but it was kind of amazing actually. So I just wanted to share that because that seemed on point with what Kara was sharing just now. So
were you able to just notice that and not judge it and just sort of be with that?
Yeah. At first I was like, wow, that's surprising. And then I was very curious about where it was going to lead. And I was hoping, like, I was just really curious about it and just wanting to be in it and really wondering where it was going to go next. But then I think I just got distracted at first by, sort of how powerful it was. That makes sense. Yeah.
Thank you for sharing that. And I have to say, when I first started using it in my practice, I noticed obviously not everything is a good fit for everyone, but I had some clients who, once we found that spot and started processing, just overwhelm, emotion, tears just flooding out. It's like they hit something that was never there before. And we'll process, like we did, like 3 minutes. So I will sit for 40 minutes of the session, just sitting, processing. And the other difference too is I can't see you guys really. I have little tiny clippets of faces, but I can't see everyone. If I'm one-on-one in person, or I'm with someone, even through Brainspotting on now the new normal right now, through like telehealth, I'm watching their involuntary reactions. So you guys did the pointer left, middle, and right. That's called inside window. Or outside inside window, because it's you're looking for what spot connects. When I'm doing an outside window, I'm starting and I'm slowly moving the pointer across the visual field really slowly. And I'm looking for things that you don't even know are happening. I'm looking for like an eye wobble, a jump, maybe a double blink, or sometimes twitches that people don't know they're having. And when those twitches happen, then I note to myself, okay, that's a spot. And then after I go through the visual field, I'll say, I like to do inside-outside combination. So I'll say, okay, where did you feel it the most powerful? And 9 times out of 10, they'll tell me to move the pointer back to where I noticed something. But I don't tell them I noticed something. I kind of, want to see if it lines up. And often I will see what's happening physically at that spot and know that that's a spot for them. And when we're processing and people have that overwhelming emotion and we kind of let it continue to go, I do find that I have had people that say, after I left your office for like 2 days, I was a little bit out of sorts, but whatever the issue was I was focusing on seemed to dissipate. Like it wasn't the same as it was before. Like I've had people come in for car accidents where they get anxious whenever they get in the car. And so we've brain spotted to be able to drive past a certain street without having panic attacks, things like that. But your experience, I've seen a lot. It's pretty amazing how someone could be just talking and feeling okay. And then once we find that right spot, things just come up and they just kind of come out.
Kara, just want to sort of hone it down a little bit. When would we as healthcare workers use this? And if we don't have a therapist across from us and we're sort of self-administering, how will we know like where to stop it? Is it just where it feels most comfortable and grounded in our bodies? We don't have that observation of the therapist in the room with us.
Yeah, I would watch the SUDS level. So if it starts to get really difficult and if you feel like you can't tolerate it, I don't want anyone to feel like they can't tolerate something, then I would do a grounding or a meditation or something that's helpful. But notice your SUDS level. And the idea is to bring your SUDS level from wherever it is down to 0. In fact, the term that David Grand uses in Brainspotting, it's called squeezing the lemon. So if you're working with a client on a particular issue and you get to 0, I might say, because there's lots of different spots, right? So I might say to somebody, now that you're at a 0, how are you feeling? We might process, like talk through it. And then I say, okay, I want you to bring that issue back up in your mind and see if your SUDS level goes up again. And if it goes up again, let's find another spot. And there's the x-axis, there's the y-axis. So once we find a spot this way, you could go up, you could go down, and there's even the vertical. So there's a lot of different ways. There's one eye, I have glasses that people can use in my office, or you could just kind of cover one eye. There's a lot of different ways to really find those spots that weren't accessible before.
So for us, if we're self-administering this, we identify our SUDS level, we think of the situation, identify our SUDS level, do the bilateral,
find the spot in your body,
right? Yeah. And then just sort of notice it, fixate on the spot where it feels most comfortable, and then notice our SUDS level going down.
Yeah,
notice saying if our SUDS level is going up, to take a pause and do some sort of other intervention to reduce our SUDS level.
Yes, and I would also say bilateral music can be really helpful. So if you have music while you're doing it, or through the meditation apps, the music, and even if you don't, because it can be tiresome to hold a pen in front of your eyes. So I would say if you're doing it by yourself, sitting in a room, kind of just look around the room and notice objects, right? So maybe here it's the painting I have, maybe there it's the doorknob, and use that as your guide. If you don't want to use a pen, use the different objects in the room, and when you find that spot connected to the object, then focus mindfully on this part in your body and that spot, so that you're not, because you might sit for 20 minutes, it gets really tiring to hold something up. So you might want to just use objects around your room that can help you identify. And that's more of what they call gaze spotting versus outside inside window, is because you kind of find that spot and focus there.
Great.
Any other questions before we go to, we're going to do
in the chat or raise your hands. Nicole, hi Nicole. Nicole has a question, Kara.
Sure.
Oops.
Hi, can you speak a little bit about what you're talking about before in terms of the speakers? Would you just have that playing when they come into the office, or is it sort of always on, or is it just when you're doing processing that you would put the speakers on?
I like it on all the time, and I don't use Brainspotting with everybody, right? I do a lot of other things in the office. So me personally, there's a lot of, some people might disagree with me. I've been told by some people that it's better to use the headphones. And I actually had one client tell me she prefers, and she does Brainspotting a lot. And actually she's a frontline healthcare worker right now in the middle of this crisis. So we've been trying to do it virtually, Brainspotting, because it's been really effective with her. But she likes the headphones because she said they make me feel secure. And so they give me a sense of security and safety, because I have basically my kids' old school Beats with an old DVD player hooked up so that they put the headphones on. But other than the people that ask for the headphones, I use these speakers because somebody, I learned from someone in one of my trainings, uses the speakers on either side of the couch. So the sound is not as intense bilateral, right? Because there is speakers in the room, but it does hit ear to ear. And I prefer that because I like to have the music and I can hear it from sitting in the room with them. So when I'm in my office, not doing telehealth, when pre-COVID and hopefully eventually after COVID, the speakers are set up and turned on with my playlist of bilateral sound just on a loop all day. And so when someone comes in, and it's soft enough that it's not distracting, but someone comes in and we may not do Brainspotting at all, but the sound is still going. There's something, and even for myself, I've been coming to my office because I'm very fortunate. I have a private space with a private entrance, and my teenagers and my husband have kicked me out several times over the past few weeks. I take my speakers and put them at my desk for myself, and it helps calm me. And when I'm doing paperwork or waiting or even about to get on a teletherapy call, I like the Brainspotting bilateral music, calming music, for my own benefit, to help reduce my own amygdala activation when I'm sitting here in the office. So that's why I like it. But most Brainspotting therapists do use headphones and recommend headphones. I personally like the speakers and keep it going all the time.
Very helpful.
Any other thoughts or questions before we do the last exercise?
Okay. Hillary.
Okay.
I can unmute you. You're good.
Thank you. Just a quick follow-up to Nicole's question. If you're doing Brainspotting via telehealth, what do you do about the music? Do you just have it playing like you would? Oh, you're in your office, so you have it set up and have it on.
But I don't, because they're not hearing it bilaterally. So, and there's been, because of COVID, there have been a ton of training sessions. Other Brainspotting trainers around the country have put together how do you Brainspot over telehealth. And the consensus is, if your client has headphones and could be talking to you through the computer with headphones hooked up to a music source, as long as they're soft enough, they can still talk through the computer, but you can't have the computer through the headphones. That the computer then has to be open. But a lot of people are saying then just do it without we did it without music, and it's still effective. The EMDR music and the bilateral music definitely helps and is part of the usual way of doing it, but it's also can be really effective without the music too. So a lot of people are just doing it without it. But I do have a lot of my clients use the bilateral music on their own and have them, especially through, I think that the Insight Timer is such a great meditation app. It's one of the ones I use personally pretty often. And the fact that there's some bilateral music just through that app, I ask them to do your meditation with the bilateral music through Insight Timer. Can be helpful.
Thanks.
In the interest of time, Kara, I'd love to get to your last practice exercise.
Yeah, so this is called Vergence, and it's actually, there's some eye doctors who actually have discovered, so the idea here is that when your sympathetic nervous system kicks in, there are very, very few things that can affect the vagus nerve and activate the parasympathetic nervous system. Really, the breath is one of the only ways, right? We know, as meditation experts, we know that the breath is a way that you can access and the vagus nerve to reduce the activation. But eye movement also has been shown to do that. So with Vergence, you can either use the spot you used before or just pick a spot in front. So if you hold a pen or object in front of your face about 6 inches away, eye level, focus your gaze on the object. You don't even need to necessarily focus on what's happening, but just focus your gaze on the object itself for just a few seconds. Now notice what's behind the object. Move to the furthest point. So ideally it would be like if I'm in my office, like 10 feet away. So you're focusing on the point. Now focus looking through the point to a far wall or something directly behind it. And hold your gaze there for a few seconds. Then bring your gaze back to the pointer. And then back to the wall. So you're going to vacillate between the far distance without moving the pointer and whatever you're using as a pointer for 3 to 5 seconds at each. If you get dizzy at all, then extend the amount of time at each point before you switch. And I'm going to set a timer for 2 minutes, and we're going to practice going back and forth with the vergence and see what comes up. Anybody notice any calming effect at all with the eye movement?
I sort of noticed that my breathing got in sync with the movement. So I was breathing in as my eyes were moving and breathing out as they were coming back, and sort of slowed my heart rate. So it had a nice calming effect.
Okay, awesome.
Anyone else want to raise your hands or put a question in the chat? I don't, yeah.
Yeah, I see Dana. I don't
Dana,
have.
go ahead.
I have a question about, like, I found I was counting the seconds for moving my eyes. I don't know if that was taking me away from sort of the point of the exercise. Was that distracting me away, or is that okay to do that?
I mean, I think it's okay if you had a positive effect. Again, like with the tail of the comet, you know, Brainspotting is a big believer in whatever works, works. I would say though that counting is, you're probably focused on the counting then, and focusing on the issue or the feeling. So even if you just, you know, kind of let go of the counting and just moved as, when I do it in the office with people, I don't even say 3 or 4 seconds. I say just kind of move back and forth as you think is needed. But I just don't want people moving back and forth too quickly, because it actually does, the eye movement back and forth has been shown to stimulate the vagus nerve, and with the polyvagal theory, it actually can stimulate the parasympathetic nervous system, which is why it's used to calm for panic attacks and for panic, right? It's a tool used in panic attacks, but if you're going too fast, it can actually cause dizziness. And just like with breathing, right? We know deep breathing can increase the parasympathetic nervous system, but if we're breathing too quickly, it actually does the opposite, right? And we start to hyperventilate. So it's the same thing here. So I say 3 or 4 seconds so that we're moving at a slow enough pace, but I would go with what feels comfortable and calming. Yeah.
It's great. Anybody else? Any questions about that? Any comments? Anyone want to share an experience? If your video is off, I can't see your hand. Maybe just put a question in the chat. I don't see.
What I put for resources, so brainspotting.com has a million resources. Sounds True. I don't know how many people do continuing education through Sounds True. I love it. And a lot of the stuff is really inexpensive. So Sounds True has a course, and you can order the book that was published through Sounds True. And then there's Rocky Mountain Brainspotting Institute, and Southeast Brainspotting Institute has a lot of studies and data and information and handouts and things that you can use for self brain spotting. There's even some Facebook pages. There's a brain spotting Facebook pages where people have been posting how to brain spot through teletherapy. People have been posting actually Virgins. There's a therapist, I can't remember where she's from because New Jersey's not a big population of brain spotting therapists, but so she's somewhere outside of New Jersey area, but she has posted a video of Virgins, and she uses it at the end of every session to help people regulate so that they're able to kind of get out the door, especially when you have those doorknob kind of discussions at the end of sessions. So there's a lot of different resources on, and I have on my website as well a page that describes brain spotting that has links to different videos. There's a great video on limbic countertransference that we as therapists experience when we're with our patients or our clients. And so there's a video that David has on limbic countertransference that you can watch from my website. Also, for those, there's anybody who's into sports, the 30 verse 30 video. There's a video of brain spotting with a athlete, Mets player, on overcoming a yip, I think it's called. I don't know, sports wise, but that's also, I linked to a few different videos that might be helpful on my website under services. There's a whole page that describes brain spotting. So there's definitely some resources there if people are interested, and you can always reach out. I'll answer any questions or chat with anyone afterwards if you want to reach out. Works for me.
So I want to thank you so much, Kara. This was amazingly helpful. I've learned a few techniques that I'm going to be using for myself to keep my SUDS level low, and so that I can help people most effectively and really work on my self-care. And this was really very informative and useful. So I want to thank you for sharing your knowledge with us. What I will do with your permission, Kara, if you send me the PDF, I will forward it to everybody that's registered for this workshop. And along with the replay, if you guys want to watch it over again, just as a refresher. And I will send a link as well to some of the resources that you shared. And if in your PDF, it sounds like it has the list of resources, and you can go to Kara's website for more information.
Yeah,
so,
I'll send
you
put the slides in a PDF, and then I have a one-pager. I'll send both.
Great. If you could stop sharing your screen just for 1 second. I always like to end, we can see everybody here, which is wonderful. I want to end with everyone just closing your eyes for 1 minute and really just taking a nice deep breath in and slowly out through your mouth. Really want to honor you for showing up for yourselves today. We're on the front lines of doing some really hard and amazing work, and I want to honor you and send you all love today. Have a great day, everybody.
Thank you.